Dear friends, this film will show you how to perform self-care practices which are really effective in prevention and control of disabilities. Every person affected by leprosy needs to be aware of the risk of developing disability and the simple measures needed to thus prevent it. The affected areas, that is the hand, feet or eye, have to be inspected daily for any change. In case of a change, it needs to be reported at the earliest and preventive measures taken accordingly. The affected body part is usually dry due to no sweating and hence carries the risk of developing cracks or ulcers, similar to the cracks that we see on the earth during summer. Moistening the dry skin by soaking the part in water for half an hour twice daily will prevent cracks or ulcers. The soaking has to be followed by application of vegetable oil or liquid paraffin, which will be helpful in retaining the moisture in the skin for a long time and making the skin soft. Along with skin care, we should remember to take care of the muscle and joints. It is easy to perform simple exercises to prevent contractures and stiffness of joints. Specific exercises for paralyzed parts need to be learnt and practiced. Prevention of thermal injuries and burns is equally important. Careful handling of sharp or hot objects and using insulated and soft handles will prevent such injuries. Wrapping a piece of cloth over handles of tools or utensils may serve the purpose. Everybody wants to remain healthy and be able to perform the routine activity and try to avoid dependency on others. Persons affected by leprosy complete the full course of the treatment and follow all instructions to prevent disabilities. A little logistic support will further help them in continuing self-care practices and other measures in prevention of secondary disabilities. Persons with sensory loss over the sole are advised to use protective footwear. These footwear have special characteristics which prevent ulcers and help in healing of ulcers. These characteristics are the soft insole made up of microcellular rubber or MCR, which works as a cushion to absorb pressure on the sole while walking. The outer hard sole prevents insertion of sharp objects such as nails. The adjustable smooth strips prevent injury while rubbing off shoe. The back strip prevents the footwear to slip out from the foot. Absence of nails ensures that there is no injury caused by the footwear. A walking stick, crutch, wheelchair or tricycle will be required to give rest to the affected part for carrying out routine daily activities. A tub to soak feet in water, vegetable oil to apply over the dry skin, and splints to prevent bending of body part at the joints may also be required in some cases. You will like to ensure provision of such simple support for prevention of further damage. Persons with ulcer need to clean and dress their wounds. Sufficient rest to the affected part is essential to ensure healing. Persons with red eyes or open eyes will need goggles or eye shades. Some persons may need counseling to analyze their problems and find appropriate solution by modifying their lifestyle. Remember, materials like MCR footwear, crutches, tub, dressing material and eye shade may play a great role in prevention of disabilities and generate hope.
Management of disabilities self-care. Disability of a recent origin, less than 6 months duration, can be reversed by prednisolone treatment and rest to the nerve. A person with anesthetic palm or sole should realize that cured part will always be prone to injuries and that it needs ongoing protection. Concern for self-care needs to be created. Dry skin should be moisturized, soaked to prevent cracks. Oil should be applied after soaking to retain the moisture and to soften the skin. Muscle exercises of hands and feet will prevent contractures. Eye needs to be moisturized by putting eye drops, and eye exercises such as frequent blinking and lid exercises will prevent worsening. Regular use of protective footwear will prevent recurrent plantar ulcers.